the learning theories for nursing and allied health professionals. This is the first topic in your course, Health Education. Welcome to Health Education. So this is the introduction to health education. So learning theories refers to the theoretical frameworks which try to explain how people and animals learn, thereby helping us understand inherently complex process of learning. As a nurse, we need to know the different theories of learning so that we will be able to do it in our patient in order for them to learn what we are trying to discuss during our encounter with patient, particularly in discussing health related illnesses and other conditions or health needs by each patient. So, since learning is a process, we need to understand all the concepts related to the learning process. So, another definition of learning is it refers to persisting change in human performance or performance potential brought about as a result of the learner's interaction with the environment. We all know that every person can learn by looking at their environment through observation, through using of the five senses. We can learn our environment and every conditions that we encountered every day. So particularly when we are encountering our patient, we learn something because each patient have different attitude, different behavior, and this is uh, innate to human nature to learn. There are three main categories of learning theories. Behaviorism, which focuses on the objectively observable aspect of learning. So, behaviorism is another theories that we need to define on the later discussion. Cognitive theories, this look beyond behavior to explain brain-based learning. So, as a nurse, we also need to improve or develop our thinking. And by developing our thinking, uh, we learn a lot of things, particularly in clinical setting as a nurse. So, most of our activities are brain-based learning. We need to memorize, we need to recall, we need to know the different step-by-step procedures, and that is more on cognitive. If we fail to learn using through brain-based learning, then it will be hard for us as a nurse to determine the different concepts and principles we understand in or we tackled in our discussion in nursing. Another theories is the constructivism, learning as a process in which the learner actively construct or build new ideas or concept. So this is another thing with nursing principles that if the materials or things that is not available during the process of certain procedure, then you need to construct or build another process in order to come up with the objective. Example, when you are doing a return demonstration, as of today at present during COVID-19, you are not in the school and the school have all the materials needed for the demonstration of certain procedure. Example is bed bath. When you're rendering bed bath and return demonstration at your home, it is not available. Through constructivism, you will use another materials or another things that will resemble uh, your discussion on bed bath. So it's very important that each nurse has uh, learning methodologies using constructivism because not it in the real life, not all things are available to you. So you must be industrious enough so that the learning process would be available to each one, particularly the professional nurse. So let's proceed with the learning theories. So definition, learning theories are the main guide for educational system planning in the classroom and clinical training, included in nursing. So learning theories is a part of the system, particularly in nursing and also in the classroom setting or clinical setting. Uh, learning theories is uh, will will be discussed or part of our educational system. Then behaviorists believe that learning is a change in an observable behavior, and it happens when the communication occurs between the two events as stimulus and response. So learning is based on change in observable behavior. So if you see things, then you will react on what you see. So you will react on those what you see, and you will perform many things based on your reaction. Example, when you are conducting bed bath or you are performing bed bath and you see the patient is having difficulties, then you will adjust your behavior based on what you learned from the school, based on what you see. So there will be changes on your step-by-step procedure, particularly in communication. So you will not do things in a box. It means you do based on your reaction to what you see during bed bath. If you see the patient is having difficulties, then you will adjust your mode of holding the patient, the mode of putting your scrub to your patient when cleaning the back. Okay, so you will react and learn based on your environment or the condition of the patient, as well as your communication will change also. Okay, so there will be a stimulus and response both to you and the patient. So behaviorism is first explained by B.F. Skinner. So he is the author of behaviorism, or he explored the behaviorism theory. So also the one of the most popular person in behaviorism is Ivan Pavlov, classical conditioning theory. This refers to observable and measurable behavior. So we will go deeper in discussing this theory by Ivan Pavlov in my next slides. Then three basic assumptions of behaviorism are learning is manifested by a change in behavior. So uh, it is observable when a person is changing behavior. So you will know that there is something about him, or you something is going on to a person if the person is changing in behavior. Example, when the patient is having a high temperature, so what will happen to the patient? So there will be the patients will chill, the patients will have a cold clammy perspiration, so the patients will not move normally. So you will learn that the patient is uh, having abnormal things happening to him. So if you know that the patient, the signs and symptoms of the patient having high high temperature, then As a nurse, you know exactly what to do. Next, environment shapes behavior. So we all know that the environment helps in molding the thinking, the behavior of each person. So that's why when you see a person and he's talking a lot of things that is negative, then you will know that his environment, he come from an environment with such behavior. So we have a quotation that same feathers pluck together. Mm. So it's important that we better understand the environment that shape the behavior of each person. Same to you, in all your classmates. Not all of you have the same behavior because we have different upbringing. We have different family. Okay? Some of you uh, have experienced a lot of things, and all of you have different experiences. So this affects your behavior at present. Then next is the principles of continuity and reinforcement. So these principles of continuity will be discussed further uh, in the next slide. So reinforcement is when you help others to do the same behavior repeatedly. It means that as a teacher, when someone is not performing well in the school, so what I have to do as a teacher is I will encourage him to perform better, or I will help him to help him better understand or to cope up with the study. So in the so that is the principles of reinforcement, and the principles of continuity is uh, is by leading each students to what is the objectives of the study, or what is the aim of this course. Example, when when I put some topic today, I will add another day, another topic, so that there will be continuity in the discussion. So that is the principles of continuity. There will be a continuous input and monitoring of those input if it is reaching what is directed, or what is the objective of the course, or what is the objective of the study, or what is the objective of being taught to students. So in behaviorism, it includes classical conditioning by Parlov and operant conditioning. We will discuss this deeper on the following week. Another thing is cognitive theories. Cognitive theories consider the thought process behind the behavior. It states that changes in behavior as indicators to what is happening inside the learner's mind. So this will extract what is being what is happening in the learner's mind, and we will discuss it further on the next slides. Cognitive theories makes two basic assumptions. Memory system is an active organized processor of information, and prior knowledge plays an important role in learning. As a professor of this subject, I encourage students to take notes, because our cognitive function is not the same as computer, that we can extract our learning in a simple click. When a person writes something about what he is learning, then it will be very easy for him to recall information. And uh, it's my motivation to my students to write, because if you did not write anything, you could not recall anything. Only brilliant person do writing. Okay? That's why I encourage you to write anything that comes up to your mind so that you could recall those memory when you need it. Okay? Because your mind is not a computer. Another thing, cognitive theories, assumption is prior knowledge plays an important role in learning. So that's why in nursing, our basic or fundamental uh, knowledge in nursing is very important when you reach your level 4 because all those concepts and fundamental learning you learn from level 1, level 2, level 3 will be used when you come to level 4. Level 4 is the use of all knowledge acquired from level 1, level 2, and level 3. If you did not make it accurately in level 1, then you will continue on level 2, level 3 committing the same mistake because you did not properly execute the fundamentals of nursing at level 1. That's why it's up to you to become effective. If you did not take it on the first level accurately, then probably on level 2, level 3, and level 4, you, you will not play or you will not be an effective nurse someday because you did not get the fundamentals of nursing accurately during your level 1. So I encourage you to perfect all procedures in level 1, level 2, level 3 so that you will become a competent nurse someday. Constructivism. So constructivism is the prominent person on these theories are Jean Piaget and John Dewey. So they said learners construct knowledge for themselves from an interaction between their experiences and their ideas. It is the same thing with looking about different technologies nowadays. So the current technologies nowadays is a result of those old technologies in combination. So they combine different concept and make another one. Before, cell phone is only using click, but now using touch. Okay, touch screen. What I mean. So we construct knowledge and combine it to come up with another ideas. So the same thing with nursing. Okay, from my time during 1990s, what we have is only syringe, glass syringe, which is can be broke down when it fall to the ground. Now we have disposable syringe, and those knowledge with different medical technologies and other knowledge uh, come up with different things. That's why in nursing we can do a lot of constructivism in in our field of expertise. So that we could come up with the different ideas. So you as a nurse needs to do have a construct knowledge or constructivism theories in yourself to become industrious, knowledgeable, to become effective someday when caring for the patient. All over the world, Filipino nurses are well known for their great ideas in caring for the patient. We improvise things. If we don't have available things in caring for the patient, we improvise. We made things possible for caring the patient. Sometimes we come up with different knowledge and ideas so that we could provide quality care to our patient. Because in the Philippines, we have no budget in our healthcare facility. So we need to improvise. We need to do things to meet the objectives in caring patient without hampering the quality of services. So that's why, as a nurse, we have to that quality of constructivism theory. Another definition of constructivism, it explains learning as a process in which the learner actively construct or build new ideas or concepts based on the current and past knowledge or experience. So, in the concept of ADPI, ano, if you know the ADPI, the assessment, diagnosis, planning, implementation, and evaluation. Before, that is API only. Assessment, planning, uh, implementation, and evaluation. And now, the latest is ADOPI. So, nurses are constructing knowledge. There is always a development. Okay? New ideas, new concept. Okay? So, that's why constructivism is also tourist in learning in the college of nursing or in nursing profession. Constructivism focuses on preparing the learner to problem solve in ambiguous situation. Yan. These theories must be developed in our own self so that when we encounter problem, we can help the patient ambiguous situation. Example, in case of emergency, we know a lot of nurses helping other people in ambiguous situation. One nurses was he's not on duty but he's in the airplane and help the patient bear child at the airplane. Another one is if you know the news, one nurse is having experience in delivering newborn baby at the park or in the what do you call this in the walkway, seeing the poor woman in the walkway along Manila. So on those ambiguous situation, the constructivism theory that we as a nurse learn to solve problems. Okay? So even in our home, we need to solve problems. We should not always ask our parents on how to do these things. We need to think and learn analyze to solve things or problems in your our own situation. So conclusion, learning theories gives a general explanation of how people learn. So that is why we need to study learning theories so that we could have a general explanation for how each people learn in our everyday life. These theories are applied in educational psychology, curriculum development, and instructional methodology. So, this is needed in the curriculum development in the College of Nursing or in the nursing program. And you, as a new nurses or future nurses, can develop curriculum, can develop instructional methodology. Okay, you can create concept where at your own generation because we as a grown professional nurse uh, will leave this world and you will be the next generation to proceed with the development of new ideas, new technologies, new plan, new methodology in nursing, and with coming up with a different research. And your generation is good enough to come up with another ideas because in the later part of this generation will be there will be improvement. Most are technological. Okay? So probably your generation will see a robot nurse in the future, and that's why you need to prepare using these different theories in the future. So these are my references. Advanced Educational Psychology. This is available in the internet. Okay, Educational Psychology 8th edition. Then let's proceed with another discussion on application of theory in nursing process. So application of theory in nursing process. So theories are a set of interrelated concepts that is explanatory and predictive in nature. So all theories are interrelated concept. So this is combined with other concept, and all of them are explanatory. So we can predict things in nature using different theories. Okay? So it will help us to predict things if we know the different theories in nursing. Theories are composed of concept, definition, models, propositions, and are based on assumption. So that is the composition of theories. There is one concept, two definitions, third models, next proposition, and all are based on assumptions. Example, since we all know that the sun will rise tomorrow, then probably tomorrow the sun will rise. They are derived through two principal methods, deductive reasoning and inductive reasoning. So what is these two principal methods? Deductive means removing or deduction, and inductive reasoning means additional. Sometimes in a different concept as we grow, okay, if you know the Charles Darwin concept, what is this? That man came from an ape, okay, that we are animal. The person is an animal and we came from ape. If you study that principles, uh, some concept on these principles by Charles Darwin, some of them are deductive and some are inductive. It is because ape compared to men have the similar function of the body, and that is inductive. We accept that. But deductive, that every person came from an ape. What's what is deductive on that reasoning? We did not accept that we came from an ape. Oh, any one of you who can accept that he came from an ape? So that is deductive. But the inductive part is that all body parts or human parts in anatomical parts of the ape is similar to a person. We have They have the heart, the brain, but we are more than them. We can think more than the ape. Although the ape is one of the brightest animals in the world, uh, we could not accept that we came from ape origin, and that is deductive. So the objective of this topic is to assess the patient's condition by various methods explained by nursing theory. So we have to better understand the condition of the patient using nursing theory. Next is to identify the needs of the patient. Through uh, nursing theory, we can identify the needs of the patient, then demonstrate effective communication and interaction with the patient. It will help us to better understand uh, how to effectively communicate through interaction with the patient. And next is to select the theory for the application according to the needs of the patient. So in here, we will apply the different theories needed for our patient. And next is to apply the theory to solve the identified problems of the patient and to evaluate the extent to which the process was fruitful. Definition. What is nursing theory? Nursing theory is an organized and systematic articulation of a set of statements related to questions in the discipline of nursing. So the key words in nursing theory is organize, systematic articulation of statement. It means all the concept of the nursing theory, there is a basis. It was not taken from any other ideas, but there is always a basis, and it is systematically articulated. Okay, with flow, with process, with different set of statements. Example, hand washing. Okay, the hand washing is not created without a purpose. First and foremost, hand washing was created because they see that microorganism can be limited its transfer to other person if we do hand washing. So that is the first and foremost basis. And they organize a set of procedures, the step by step, to come up with the hand washing. If you can recall, there are step by step in doing the hand washing. There is a purpose, there is rationale why you are doing that, and there and that come up to hand washing as a technique in preventing the spread of microorganism. All things in nursing is not created without a purpose. So that's the principles uh, in nursing theory. That's why we come up with the nursing profession with a discipline as a program. Okay, and nursing is totally different with other profession. Next, a nursing theory is a set of concept, definition, relationship, and assumption or proposition derived from nursing models or from other discipline. It means some of our concepts are taken from other discipline. Example, the theory of gravity from engineering. Okay, we apply also the theory of gravity in our concept when we are handling materials, when we are, uh, if you can recall your knowledge in maintaining our body mechanics when we are bringing our materials for the patient. So, so that concept is also taken from other discipline. And it also includes project a purposive, systematic review of phenomena by designing specific interrelationship among concepts for the purpose of describing, explaining, and predicting and prescribing. So this is the total definition of nursing theory. So we did not create all the procedures without a purpose. So and objectives and rationale. So this is the basis of nursing theory. Next, characteristic of useful theory by Robert Croyle. So a useful theory makes assumption about behavior, health problems, target population, or environment that are logical, consistent with everyday observation, similar to those used in previous successful programs, and supported by past research in the same area of related ideas. Okay. The example, if you could recall Florence Nightingale, uh, I I don't know if you already discussed about the concept of environmental theories by Florence Nightingale. If you know the story of Florence Nightingale when during the Crimean War, I want you to watch the story of Florence Nightingale so that you will better understand the different theories related to environmental. So, Florence Nightingale is a nurse during Crimean War and he observed that most diseases acquired by soldier patient is about environment. They get diseases because they have no proper water, no clean environment, no water sanitation, uh, the bed is not accurate or not hygienic, and there is no materials for cleaning the wounds. Okay, so why he created the environmental theory? It is because it's logical. You will not have, you will not acquire disease if your environment is clean. Okay, so patients are getting sick because of his present environment. That's why students, if your boarding house is not clean enough, then you will get sick. If you did not have a proper water in your boarding house or in your home, then you will get sick. If you don't have a clean bedroom or comfort room, then you will get sick. It's logical. So another thing is consistent with everyday observation. Since most of the patient during Crimean War don't have the accessibility for good water sanitation, good environment, uh, uh, hygienic things, or the what do you call this? Our hygienic tools like toothbrush, soap. Okay, if this is not given every day, then there will be a consistent diseases continuous every day, and that what is what being observed by Florence Nightingale during his time. Then similar to those use of previous successful program. So what Florence Nightingale did is to create programs in cleaning, teach the nurses to clean the environment, clean the patient, provide the bath, okay, provide hygienic materials, provide safe water. So that is a successful program introduced by Florence Nightingale. So even Florence Nightingale conduct research during her time. Okay. So and that create ideas for all nurses in order to help the patient recover from diseases. So importance of nursing theories. Nursing theory aim to describe, predict, and explain the phenomenon of nursing. So it helps us to explain certain things or idea, phenomenon in nursing. Then it should provide foundation of nursing practice, help to generate further knowledge, and indicate in which direction nursing should develop in the future. Theory is important because it helps us to decide what we know and what we need to know. It helps us to distinguish what should form the basis of practice by explicitly describing nursing. Another thing, it describes the benefits of having defined body of theory in nursing include better patient care, enhanced professional status of nurses, improved communication between nurses, and guidance for research and education. So those concepts and theories help us to better improve the quality of nursing care in our setting, in different setting, because not all nurses have the same setting. Example, during the COVID-19, so nurses come up with different procedures in fighting with COVID-19 to define or to differentiate the normal and new normal. So they apply all principles, even communication, even the procedures. They change all the procedures uh, be compared with the previous activities. Example, during COVID-19 was not erupted in our case, we can talk face to face. But now, since the arrival of COVID-19, those protocols have been changed and all process have been changed. And it's based on nursing theories so that we could improve our services, limit the transfer of microorganisms and viruses to each one of us. And that is, it has a guidance and basis from research, it based on study. Another importance of nursing theories, its main exponent of nursing is caring. Cannot be measured. It is vital to have the theory to analyze and explain what nurses do in order to provide a quality care to the patient. So to sum it up, nursing theories, our basis is caring. We all do, we all use knowledge, concept, ideas, and principles in order to provide care, which could not be measured. Okay, being a nurse, it is I'm elated or I have a good heart seeing person is being cared of, and that is one of the great achievement each of you can do to your patient. Okay, when I was in college, I'm I'm very loved by my patient because they feel that I care for them. I did not leave my patients without talking to them, asking their needs, caring for them. I care for them like my family member. So they see me eh, as part of the family. And sometimes in return, they give me something. But since we are a nurse, we did not accept things from our patient. And that will show us that we render a quality care when the patients did that, okay, as a form of appreciation to our services. Another thing, as a medicine tries to make a move towards adopting a move multidisciplinary approach to healthcare, nursing continues to strive to establish a unique body of knowledge. Okay, since nursing theory is a body of knowledge, we as a nurse, we care to the patient not only alone, but we have a multidisciplinary approach in which we seek collaborative effort from other profession. Okay, meaning we seek the help of the doctor, we seek the help of nursing aid, we seek the help of maintenance, we seek the help of X-ray technician, the medical technologists, and all part of the healthcare team because we could not render certain care to a patient alone. We need the laboratory results. The laboratory results will help us interpret what is happening to the patient, what is actually happening to the patient, because we could not guess what is happening to the patient without laboratory works. And that is part of the multidisciplinary approach. We need each other. But a good nurse can interpret all those uh, intervention with the uh, with the patient. This can be seen as attempt by the nursing profession to maintain its professional boundaries. It means that we as nurses we have limit boundaries as a professional. For example, nurses could not prescribe medication. It is the job of the doctor, and that is our professional boundaries. We could recommend medication, but it's not our what that is not our uh, work. Okay, so that's why we as a nurse should know our boundaries, our limit, uh, based on our function, based on what we should do in our patient. Doing those boundaries beyond our profession will put us into a legal um legal case. So we as nurses should not attempt to do the beyond professional boundaries assigned to us being a nurse because uh, it will put us in legal issues that will contempt us, particularly if we have our own license. The, it will be revoked because of attempting to do beyond our professional boundaries as a professional nurse. Evolution of nursing theories and application. So the history of professional nursing begins with Florence Nightingale. So he's the modern he introduced the modern professional nurse. So later in last century, nursing began with a strong emphasis on practice. So we need more on practicing all our procedures in order to render quality care to the patient. Following that came the curriculum era, which addressed the question about what nursing students should study in order to achieve the required standard of nursing. Previously, nurses don't have curriculum because nursing is a vocation during that time, and up to this time, nursing is also a vocation. So, if you have a vocation in your heart, you can do nursing. But nowadays, in the curriculum era, nurses should be intelligent enough to better understand all the concept of nursing, including the body of the patient, using the anatomy, understanding the function of each system of the body. So it's not only a vocation, but nursing is also needs a brilliant mind in order to come up to become a professional nurse someday. As more and more nurses began to pursue higher degrees in nursing, there emerged the research area. So nowadays, nurses required to have at least 2 to 3 research so that you could continue the uh, professional development. Later, graduated education and master education was given much importance. So this is related to us being a clinical instructor because nowadays you could not teach nursing without upgrading your nursing profession to uh, master uh, in nursing, and that's why I pursue my PhD degree because as a clinical instructor, we should continue our professional development so that we could provide a quality nursing education to each one of you. The development of theory era was natural outgrowth of the research area era. So one of the problem nowadays is the research capabilities of nurses in which we are poor, particularly in the Philippines. We are poor in creating research, particularly in the development theory in nursing. That's why I encourage you when you became a full-fledged nurse, you should continue research work for the development of our profession. Next, with an increased number of researches, it became obvious that the research without theory produce isolated information. However, research and theory produce the nursing science. So, it is badly needed in the nursing profession to have a research based on different theories from previously done by old researchers so that we can produce more knowledge in nursing. Characteristic of theories. So, interrelating concept in which a way as to create different way of looking at a particular phenomenon. Next, it's, as I said, it's logical in nature, generalizable, and basis for hypothesis that can be tested. So this is the characteristic of theories. So it must be logical in nature, generalizable, and basis for hypothesis that can be tested. Example, if you have one phenomenon that want to be studied, so the purpose must be logical. Why you need to better understand those concepts you want to know related to different theories. So when it's generalizable, it does not conceptualize in certain issues, but it will help the general issues in broader sense. And next is the hypothesis can be tested. So you will better understand this when you take the subject research in nursing. So increasing the general body of knowledge within the discipline through the research implemented to validate them. So the purpose of theory is when it is implemented or applied, then it will be validated, meaning it will be accepted, it validated. Certain issues like rumors, you will not only believe in rumors, because if you just believe in rumors, you will encounter problem. So if rumors is true, you must validate it and you must do something to know it's the rumors is true or false. So nowadays there are many what do you call this in our news. Some news are not true. Okay, fake news. So you need to validate them so that those knowledge you acquired from the internet eh, to know if that is correct or validated because there are false information coming up through social media. Next, used by practitioners to guide and improve their practice. Okay, I could recall the different processes in nursing when I was students during 1990s. Those knowledge acquired during my time is now not applicable in your time. So there are a lot of changes based on improvement, based on conditions, based on the changing environment. That's why you need to continue study and improve our knowledge so that it could help in maintaining quality nursing in rendering to our patient. Next, consistent with other validated theories, laws, principles, but will leave open unanswered questions that need to be investigated. So, to improve our theories or knowledge, we need to have a consistent review and validate all those knowledge and concept so that it will be applied uh, in our future profession. That's why if you will see there are a lot of books and it's being improved every now and then. Every year you will see the books is having first edition, second edition, third editions because uh, all knowledge can become obsolete. That's why we change books, books, upgrade our knowledge, change our procedures from now and then. Purposes of theory in practice. So this will assist nurses to describe, explain, and predict everyday experience, serve to guide assessment, intervention, and evaluation of nursing care. So this part of the nursing process uh, because we all base our practice based on the nursing process. It's the fundamental. That's why I want you to better understand how to apply the nursing process. Next, provide a rationale for collecting reliable and valid data about the health status of client, which are essential for effective decision making and implementation. Part of the theory is to collect reliable and valid data to our patient. That's why you are being taught how to take physical assessment, how to take the vital signs. If you did not perform collecting appropriate vital signs to your patient, it will affect your nursing care. It will affect the interpretation of the doctor to the patient. And if it's not reliable, then you will create problem to the patient. Example, if you take blood pressure to your patient and it's not correct and it read abnormal, example, our normal BP is 120 over 80, and you take it incorrectly and you took it about 140 over 90 and you report it to the doctor. Since you made a mistakes providing information or data which is not reliable to the doctor, then the doctor will create prescription for high blood pressure. So the patient, so now you will give the medicine to your patient and it will create uh, bad effect to your client since the BP of the patient is not 140 over 90 and it is 90 over 60. Providing the hypertensive drugs, the purpose of hypertensive drugs is to reduce the pressure to your patient. So 90 over 60 will go down. So it will be a problem. You will kill the patient. So that's why we as nurse must provide a reliable and valid data to our doctor or to any other healthcare professional so that we will not have any consequence to our patient. But if we render correct taking of vital signs, then it will help us to effectively in making decisions and implementations to our client. Another thing, the purpose of theory in practice is to help to establish criteria to measure the quality of nursing care. Next, help build a common nursing terminology to use in communicating with other healthcare professional. Ideas are developed and works defined. So part of theories in practice is the creation of a checklist. Take note when you are studying nursing, there are a lot of checklists you should memorize. You should memorize it by heart and apply in your daily activities. And that is the creation or output of the theories in practice. Next, enhance autonomy, independence, and self-governance of nursing by defining its own independent function. So all nurses have different function. Well, the independent function is a function in which nurse should not seek help from other colleagues. It means that is the primary functions that we have. Example, providing bed bath, caring for the patient, taking vital signs. Those are independent nursing function. We don't need other profession in order to do that. And that will help us to enhance our autonomy by making a proper schedule, when to take the vital signs, when to, what we will do if the patient is having high temperature. So, so that we could render continuous and quality care to the patient. Purposes of nursing theories in practice is to assist nurse to describe, explain, and predict everyday experience. When the patient is having, example, having a wounds, so we can explain better if we do our independent function that is to provide first aid. And if we render first aid, we can predict tomorrow that wound healing will be applied or will take effect because we know that we render the proper uh, first aid to your patient in order to come up so that the patients will not have further bleeding uh, in the scar or in the wounds received by the patient. Serve to guide assessment, intervention, and evaluation of nursing care. So, theories in practice, because we learn the proper assessment to our patient, then we could render intervention. At the same time, we could do the evaluation of nursing care. You have a subject of health assessment. I want you to study that very well because you will use it all throughout your life being a nurse to assess your patient. But these things cannot be applied only to your patients, but as well to your family members. It's good thing that you became a nurse because nurse is a general profession in which can be applied not only in your job but can be applied also in your family if you who know its purpose in the nursing profession. Next, provide a rationale for the collecting reliable and valid data about the health status of clients, which are essential to effective decision making and implementation. So all things we are doing in nursing has a rationale. What is rationale? This is the reasons why we are doing it. It's the ideas or knowledge or explanation why we are doing things. So that's why before doing things in nursing, you must know the rationale. Next is to describe criteria to measure the quality of nursing care. So since we have all the full knowledge of the different activities in nursing, so it helps us to describe and measure the quality of nursing care because most of our activities in nursing or procedures have his own checklist. Naka-checklist po lahat ang ating mga activities in nursing in rendering the different procedures. Next, it helps build a common nursing terminology to use in communicating with other healthcare professionals. So I have medical terminologies, a book of an ebook of medical technologies. I share it with a subject in skills lab for health assessment, and all of our activities in nursing have different terminologies, and we use that in communicating. That's why all nurses must read every day. You must read every day so that you will better understand the word or the key concept in every subject that you are studying. So if you don't know the term, you must refer to the medical terminologies. Do not read something in nursing without understanding. And to help you understand meaning or keywords in nursing, you must look always in the medical terminologies that I will provided in health assessment subject. Next, ideas are developed and words are defined. Okay. In nursing, we have term, layman's term, and clinical terms. So those things help us to define and develop ideas and help us to come up with certain things in nursing. Enhance autonomy. Oh, sorry, I think I done with this. Then, does this theory reflect nursing practice as I know it? So these are the different questions that you have to resolve. Will it support what I believe to be excellent in nursing? Yes. Um, Theories can help you be excellent in nursing practice by applying those theories. Then, can this theory be considered in relation to a wide range of nursing situations? Yes. Then, personal interests, abilities, and experience. And what will it be like to think about nursing theory in nursing practice? When you know the different theories in practice, it will guide you in pursuing the quality care to your patient and to you as well when you're taking care of yourself. Because most of the learning we acquired in nursing will help you to become a better person, to help you become professionals, to help b- a better member of your family. Because all your learning can be applicable to your family as well when when you grow up. Will my work with nursing theory be worth the effort? Yes, it will worth the effort because nursing theories is the fundamental knowledge in all aspects of nursing practice. So let's proceed in nursing theories in education. So not all of you will become nurse in clinical setting. Some of you will become a nurse clinical instructor. So if you are nurse clinical instructor, nursing theories will guide you in creating curriculum design, creating nursing concept in different field of nursing. So like this, creating curriculum and help you in making decision making when you are making curriculum for nursing or for upgrading the curriculum of nursing so that nursing will be equipped for future profession when we are thinking about the nursing evolution. Just imagine if Florence, Florence Nightingale concept are being used today. So it's now it's obsolete. Okay, so it will not be applicable today because only different concept will be applicable, but the setting during the Florence Nightingale will not be applicable today because of the changing technologies applied in nursing. Nursing theories in research. So when pertaining to nursing theories related to research, so this will be on your level 3. So nursing theories are generated from the knowledge and ideas created by uh, nurses, particularly those nursing theories like OREM. They conceptualize the different staging of knowledge in nursing, assist in discovering knowledge gaps in the specific field of study, and offer systematic approach to identify question for study, select variables, interpret findings, validate nursing interpretation. These are all key concepts in research. So any nurse professional should have a systematic approach when dealing with different studies in nursing. Yeah, when we encounter different diseases. So if you are a nurse, you should not depend only on your acquired knowledge. You need to do a lot of research in order to come up with a quality nursing care to your patient. Sometimes when I was applying my professional practice in Saudi Arabia, I have to read many books pertaining to certain diseases so that I will be equipped with full knowledge and skills because some skills are not acquired during my college days. And imagine for 30 years. So the different approach to different diseases are changing If I use my knowledge during 1990, it is not applicable at this moment. That's why nursing should have a systematic approach in identifying diseases, because you will encounter a lot of questions when you are rendering services to your client. How should it be done correctly to your patient, or how to alleviate or reduce microorganism in the wounds of the patient while you are giving medication. Sometimes you provide 7 days medication, antibiotic, and yet the patient is not relieving from the disease. Then you have to study further. So you need to read books and identify what is the most appropriate medication for your client. And by understanding that, you could suggest to your doctor, probably this is the main culprit in why the wound of the patient is not healing. So you need to evaluate even the different laboratories performed to your patient, and you need to identify which is the gap, which is what is wrong in our medication, what is wrong in our services, what is wrong in our nursing intervention. So, since needs a lot of theories, we need to go further and study more in certain conditions so that we address the gaps, address the question, know the different variables on those factors that affect the patient, and find the right interpretation so that we could render the quality service, and it is validated through research by seeking nursing intervention, medication, and lot of things when you become a nursing professional someday. Next, approaches to developing nursing theory. So all approaches are changing. Okay. Nowadays in research, I discovered when I study PhD that there are a lot of methodologies nowadays available on online, internet, and in books in order to render research the most effective and easiest way. So I learned that from studying PhD. Next, borrowing conceptual frameworks from other disciplines. So as a nurses, or as a nurse, in our nursing theories, some of them are borrowed from other discipline. Then nursing theories in research is inductively looking at nursing practice to discover theories, concept to explain phenomena. So as a nurse, we need to discover a lot of concept and other theories applicable to certain phenomenon in our uh, field of nursing. Deductively looking for the compatibility of general nursing theory with nursing practice. So as I explained previously, we have inductive and deductive process or methods in discovering knowledge or theories in nursing. When you say inductive, that will be included. Deductive will be deduction based on my example of the ideas of Charles Darwin that men came from ape. Questions from practicing nurse about using nursing theory. So this is included. We had a lot of questions. Take note, questions was created in order to gain another ideas, to improve ideas. Without questioning, then we will not improve this nursing practice. We will not improve this world without questioning. Previously, metal is not flying, but because of the changing generation, one of my example is airplane. Before, nothing is flying in the sky, but because of questioning how you could use metal in flying, it is because of man's ideas, intellectual capacity of human person to interact with the environment, to create things. Okay? On the old days, we use uh, wood or bamboo to as a boat, but nowadays we use metal, okay? Which we previously they think it's sinking when you use metal, but nowadays metal is floating on the sea. That's why it is because of ideas. It's because of questioning. Conclusion: if theory is expected to be fit, benefit practice, it must be developed cooperatively with people who are practicing nursing. People who do research and develop theories think differently about theory when they perceive the reality of practice. And theories do not provide the same type of procedural guidelines for practice as do situation, specific principles in procedure or rules. It means theories help us to improve our practice. It helps us to develop cooperatively with other person in practice, with other discipline, multidisciplinary methods, and through research, it can improve our theories so that it will be applicable in the real real practice. So as a result, we create procedural guidelines, we create books, we create practice that defines our situation or our limitation as a nurse. So we create specific principles and procedures or rules or guidelines so that we could follow and render the quality of services in nursing. So thank you very much, and that's all. I hope you will do additional reading based on the provided concept as I included in the resource provided in the NEO MLS. So you will have what you call this? You have a little quiz about 1 to 10 quiz so that you could recall what's being discussed in this uh, discussion.